Dr. Stegeman. I only go to folks that I really believe in and that I like and trust, because I have friends here that I have known for most of my life, and I never want to send them to anyone who I don't really trust. It's as simple as that. I've been sponsored by shoe companies and all this stuff, but I don't put anyone in anything that, unless I really know it's going to work. So when I send anybody to you, they've already believed in what you're doing. And so Dr. Stegeman is to me a very fine young man. Say young. And
Appreciate it.
Only 28, right?
Everybody's 28 today. Has so much to offer.
More months.
And I hope that each of you will take home something, or a few things, today and tonight, excuse me, and we'll utilize it. So this is a great group of folks. Have fun with them.
Appreciate it.
Okay.
Thanks so much.
He's already had fun with me, so.
Yeah, got rid of a little bit here.
Yeah.
Anyways, my name is Dr Stegeman. I'm a physical therapist, have been so since 1990, dating myself. Been in the States since '94, practicing as a physical therapist in hospitals, outpatient clinics, home health, skilled nursing facilities. But this over here, outpatient, is my real passion. I mean, this is the most fun I have as a physical therapist, and it's a lot of fun. This is Holly Holly Schmidt. We have two Hollies over here. Anyways, she's also a physical therapist, also doctor of physical therapy. We both graduated from the University of St. Augustine here in Florida, which is a great school, by the way. Anyways, we also work here with 3 other therapists, and so this is a 5-therapist practice. We don't have any techs or assistants working here, and we see about 55, 60 patients a day in this clinic. At least we try. And we love what we're doing, and that's why we're good at it. We all come from corporate physical therapy, which used to mean that we saw about 20 to 30 patients per day, which really rubbed us the wrong way pretty much, because we really couldn't give the patients what they needed, which was great care. And that's what we're trying to do here, and that makes us different. And that's all I'm going to say about that. I'm also a runner. I've done a couple of marathons, a couple of half marathons. Over the last 15 years I've become a runner. I mostly became a runner because I was a tennis player, then my kids came, and you can't play tennis with kids. You can run with kids in a stroller though, and you can run with 2 kids in a stroller also. You get real good at running all of a sudden, which is great actually. So after the kids came out of the stroller, I kept running and did my marathons at the Goofy and whatnot, and that kind of stuff. It's so much fun. And it's great because you can eat whatever you want and you still look like this. So it's great for me, at least. Anyways, a couple of my other clinicians or other co-workers are also half marathon runners, and we like what we're doing. The whole running thing in physical therapy is pretty big. It's also pretty specialized. Not everybody can treat runners. It's one of those things that if you have an interest in that, you do more and more courses as far as running is concerned, and then you pretty much little by little specialize yourself in what's happening to runners. It's not just people come in with their foot and then you treat the foot and everything gets better and you can run off again. Usually there's a reason why things happen, and quite often the reason is not exactly where you think it is. I'll go over a couple of things, over a couple of injuries that people can have. Your body is used to stress. It can take a lot. If you're running, it gets a lot of stress. Usually it can dissipate those forces really good, unless there is something that is not right. The body needs to be able to run. It needs good range of motion. If you're stiff and you try to run, you have a higher chance of hurting yourself. It needs fairly good strength, because if you're very weak and you try to run, your body cannot dissipate those forces, and it's gonna again get injured. It needs good stability. If you have bad stability, all kinds of things can go wrong also, and translate into a whole bunch of injuries. And it also needs power. If you want to increase your speed, increase your distance, you need power. And power is different than strength. I mean, power is not your absolute strength. It's not how many pounds you can push or lift. Power is more how quickly you can recruit your muscles over in a short period of time. So when you do a 10K, it takes you 2 hours and 31 minutes, then, I mean, to not slow down to a walk, or at least to a very slow walk, you still have to power through it. You have to have a certain amount of power for that. And the more you train, the better the power gets. That's how you can do it 10K. Congratulations. More power to you. Anyways, I'll go over a couple of things as far as things are concerned. If you have any injuries, you guys all had your share, I take it, of little injuries and bigger injuries. Nobody without injuries here?
Well, you know me, so.
Well, yeah, let's not talk about you.
Yeah, I'm a big one.
That's okay. But, I mean, if you have any questions about any of the things, I mean, just interrupt me. It doesn't matter. A little bit of interaction is always a good thing, so please ask. Anyway, we'll start with stress fractures. Stress fractures are pretty serious quite often. Stress fractures can happen to anybody, and it all depends on not only how strong your bones are, but also how much you irritate the bone by running, and usually a pretty long distance for that matter, to get a stress fracture. Stress fractures quite often happen in the tibia, in the lower leg. The problem usually is that you do too much, too soon, too long, too hard. And this usually happens when people train up for a certain distance and they start really going too fast, too quick. Your body cannot adjust to it, and then it starts to fail. And usually, I mean, hairline fractures can be very painful. Some people try to run through those things, and they get really in trouble with that because it's very tough to run through. You have to adapt your training to cross-train, like Lynn already said before. Swimming is a great form of cross-training. The more you cross-train with those kind of things, the quicker it heals up again, the sooner you pick it up again. Quite a good, smart thing to cross-train anyways. As I said before, your body needs range of motion, strength, stability, and power. If you cross-train, you develop those different muscle systems a lot better. For every runner, some core strengthening or some strengthening in general is a very, very smart thing to do. And that's, again, where Lynn's core strengthening class or strengthening class comes in really, really handy. Also, obviously, if you're a runner and you run longer distances in combination with shorter distances, which you do faster, you're also training different muscle systems, so that helps also quite well. The only thing is, if you do more fast work, you have a bigger chance of injuring yourself again, so you got to be careful with that stuff. So it's always good to very gradually build that up, and again, that's where Lynn is helping everybody with. All right, let's go over a couple of other things. Let me see if I can start this thing up. Femoral syndrome. Knee pain is always a funky one. Most people have had knee injuries, knee irritation, knee discomfort afterwards, some swelling in the knee. Most of the time, the problem is, I mean, this over here, what's happening in the knee is a symptom. The problem is usually somewhere else. It's either in the hips or in the feet. Most of the time, it's in the hips. When you land with your body, some people say it's about 2.5 times your body weight that's on that leg. So if you weigh 135 pounds and you run, it's not the 135 pounds which is on the leg. It's about 200 pounds extra which is on the leg. So when you run, every step you take, you're putting about 300 pounds on that leg, which it normally can take just easily without any problem. And it can take that 1,000 or 2,000 or 10,000 steps fairly easily also. Unless there's weakness in the hip, then all of a sudden, every time you land, you're gonna see especially in slow motion. When we do our gait assessments, we can see it in slow motion on the treadmill real easily, that your knee starts to go in. And every time that happens, the tracking of the kneecap will be off. Now, if you do that a lot, it starts really to irritate the knee, and that's where quite often the patellofemoral syndrome or knee pain in general comes from. Same with the jumper's knee, which is an irritation of the tendon of the knee. Same deal happens with that. Some people have those little braces. Lewis has those things for us playing tennis. Those things do work, but they're only taking care of part of the symptoms. You really want to work on, and that's what we do over here usually with people who have a lot of problems. We work more on hip strength and hip range of motion, hip stability to make that better. And I'll show you a couple of things later on which we do with that. Anyways, so that's as far as the tracking of the hip is concerned. All right. Iliotibial syndrome. I mean, most people have had that tightness on the sides. Can go all the way down to the knee again and irritate over there, which is sometimes they also call bursitis over here at the knee. Some people have pain all the way going up into the hip even when they're walking. And again, that has everything to do with the leg going in and the body trying to stabilize it with the muscles on the side here, which then starts to irritate at a certain point. And again, we do a lot of hip strengthening for that. And again, I'll have you all do some hip exercises so you get something out of this. Don't hurt yourself though. Talk to your doctor before you do any exercises. All right, plantar fasciitis. Lots of people have had plantar fasciitis. Plantar fasciitis is an irritation of the plantar fascia on the bottom of the foot, which usually is there because of either too flat a foot, which when you're running, you're stretching that out every time and it starts to irritate pretty heavily at the beginning of the fascia. Sometimes it's also a stiffness in the ankle, in the foot itself, that every step you take, it starts to irritate also again in the plantar fascia. So usually what we do, we increase the range of motion, increase the stability, give you stretching exercises. You can do a lot of these things yourself at home. The icing, the stretching, the rolling over frozen bottle type things. We also do a lot of strengthening exercises for the foot to make sure that the muscles get stronger, and that usually takes care of the problem. Sometimes some people have to have injections with it. Injections are helpful at times, but you don't want to have a lot of them because they sometimes degenerate the tissue pretty heavily. So you got to be careful of those kind of things anyways. But there's a lot of things you can do about it yourself, and obviously good running shoes is a must. If you're a runner, you need good shoes. You cannot run on $30 shoes which don't fit well, because you will tear things up, obviously. So make it a good investment. Invest in great shoes, because you're going to make a lot of miles on those shoes, hopefully. Now, if anybody has any questions in the meantime, ask.
How about Morton's neuroma?
Morton's neuroma, that's a nice one. Morton's neuroma is a compression in the foot, and usually between the third and fourth toe of the nerves. Usually that is because of the sinking in of the longitudinal arch, which is a different part of the arch of your foot. And because of that, you get compression of the joints, and you compress the nerves really nastily in between the joints.
Like wearing high heels.
Yes.
Yes.
It can be very, very irritating, and your toes can go numb, and it can start to burn, and be extremely painful actually also. Some people have it operated on. They just take away the Morton's neuroma. Some people get injections, cortisone injections to it, which takes away the inflammatory reaction somewhat. That sometimes helps also. Some people have to have a good insole with a good pad in there, metatarsal pad, which pulls the joints apart a little bit. But sometimes those things are just not enough. Quite often what we do over here for those things is a ton of strengthening of the foot, mobilization of the joints of the foot itself. Sometimes you can get away when you're running to run a little bit wider, which is a little bit counter. I mean, if you're running on a track and you're on a line, just go like a centimeter or a couple of centimeters further out. It changes the position of your rear foot, and it might take some of the irritation away. That sometimes helps also. But and again, are you cured?
I had to suffer through it and basically vow I never wear high heels.
I know where I go.
You just can't wear them.
All right. Well,
As a young person, getting my dad.
sometimes they're I mean, you can do a lot of stretching and strengthening yourself. You should be. Then again, sometimes not enough, and you got to visit a really good podiatrist. That helps also sometimes. So, good luck with that one. All right. Achilles tendonitis. One of those other things that a fair amount of people can get from irritation. Sometimes it's because of the underground that people run on. Concrete is usually a bad place to run on. It's hard, but sometimes you have no choice. And if you run a couple of miles on concrete, it can be pretty damaging. Usually the underground goes from concrete to asphalt to treadmill and asphalt are pretty equal, I think, if I'm not mistaken. Then go into grass and more real running surfaces. I mean, like the running courses, the softer stuff. Asphalt and concrete are tough on your joints. They have very little give, and all the energy goes right through. If there is anything going on with the ankle, if the ankle does not work perfectly, or if there is stiffness in the ankle, that energy will, really a lot of energy will go through certain parts of the joints. And for Achilles tendonitis, for sure, it's an overuse injury that starts to irritate your Achilles tendon really, really badly. Usually what we have to do for that, if we get those patients, is we mobilize the ankle again, make sure that everything works perfectly. We do a lot of stretching for Achilles because this is supposedly the strongest tendon in your body, although it can snap. And if it snaps, you're not very happy because they have to fix it, and it's going to cost you half a year at least before you'll be running again, if not 8 months to 9 months. So when you do stretch that out and you get your calf back to good length, stretching, by the way, is an important thing. When you get your calf back to good length, then we'll do a lot of strengthening exercises in general for the foot, the leg, the hip, and the core. And usually after that, the Achilles tendonitis disappears. Again, some people have to go to PRP injections, sometimes proton-rich plasma injections, and some people have to have surgery for it. But then again, don't let it come that far. There's a lot of other stuff you can do. Sciatica. Nobody here has back pain, I take it, so... Okay. 96% of everybody gets back pain, so pretty much everybody in this room will have back pain at least once in their lifetime, but most probably more often. It's one of those things. There is a lot you can do about that. Now, if it gets worse because of running, then you certainly have to do something about it because it's going to impede your running pretty strongly. It should not be that every time you run you have severe back pain. That's not something that should happen. Usually what we do for sciatica, depending on where it's coming from, if it comes from the back, we do a fair amount of range of motion improvement again. So it's a lot of stretching, a lot of core strengthening because your core should be able to stabilize your spine while you're running. And then also usually a lot of strengthening of the hips, getting your stability back so you can stand on one leg while you're moving, that kind of stuff. And after that, in general, just running form. And again, that's where Link comes in because your running form is absolutely really, really important. It's also the most safe way to train up, and again, after those injuries. Yeah, let me not talk too much about other stuff there. There are a couple of things we can do for ourselves during running to minimize a lot of injuries. There are a couple of cues you can give yourself. And some of those cues are keep your posture neutral. I mean, you got to keep your posture up. If you see people that are going forward, when they're running after half a mile. That's not where you should be. You should be able to get your posture up. If you're not able to get your posture up, then maybe you are pretty tight up front and you have to do more stretching, like doorway stretches or anything to get your shoulder blades back. What it will do is, little by little, if you focus on running up, your form will get better. That's also for runners who swing their arms in. Normally, if you're opening up a little bit, if you're straighter up, you swing your arms forward. So you can focus on at least keeping your arms fairly forward. Get straightened you up. When you get fatigued, most people start to go in again. Try to get yourself up again, because you're training yourself. By doing that more and more, you get stronger and stronger. It's a smart thing to do. Cadence. Most runners in general, if you're a fair runner, you have a cadence of anything around between 165 and 185 ideally, which is like about 3 steps per second. That's what it comes down to, maybe a little bit less. It all depends on whether you're going uphill or downhill, on your personal preference. I mean, not everybody runs the same cadence, but if you increase your cadence a little bit, you spend a little bit less time on the floor, so to speak, and it runs a little bit safer if you increase your cadence. There is less energy banging in. So the slower you go, the bigger your steps you take, the more energy comes down. So if you take a little bit smaller step, 95% from what you would normally do, you have less impact, and you cycle a little bit quicker, which is a good thing, but also you just get less injuries because of it. Some people call it pose running, I guess. Is that correct?
I'm sorry?
Pose running. That's I think it's a method where they decrease the step length by like 10%, and you just cycle through a little bit quicker. It's one of those things that can decrease injuries pretty good. So that's something you could try also. The other thing that they always say is to run soft. If you hear somebody next to you that you can hear banging down when you run a race, that's usually not such a good sign for that runner. If you run soft, you absorb more energy again, and you can prevent some injuries that way also. Try it out. Run as soft as you can, and you'll feel that you run different than what you normally would run like. Go for it.
Willem, we wrote an article, Dr. Stegeman and I, about upper body running, and it's in this issue's of Race Place, and it's exactly what you've been saying. Try to take that pounding by using more of your core, your upper body, and I know what you're saying about pose running, but some of the faster runners, the long distance runners.
Last thing I'm going to say is, when you're, like I said before, when you're landing with your knee, do not let your knees go in. You see some people running that every time they land, their knees go in, which means severe weakness of the hips. Keep your knees going straight forward. Don't let it go in. In other words, shine the flashlights forward. I mean, always shine the flashlights forward, because it makes a huge difference for your running. So if you focus on doing that, at least you have way less chance of iliotibial tract syndrome or any patellofemoral syndrome or any other of those overuse injuries that runners usually can get, actually. Anyway, those are the things I wanted to talk about a little bit. We're going to do a couple of things, but first, any questions about any of these things that I just go for it?
Well, I'm walking really, really slow, but I noticed that when my legs start to swell up, like they are today a little bit, okay, I'm getting tingling in the front, and that's only since I started walking.
Yes.
No, I don't think that's shin splints. I think is that good or bad or what?
Does it happen only when you're walking, and when you're walking longer?
No,
then it
it's
comes
after.
out?
It's after. It's in the recovery. So it's
Okay.
after I finish walking.
Tingling is always compression of nerves, so something's compressing on there.
Yeah. So when I'm noticing it's swelling,
Yes.
okay, then I just
Most
do
of the
something.
time that can be compartment syndrome. Your muscles are encapsulated in a fascia, it's called. And when the muscles swell up and there's too much fluid going down and not enough going up, it just doesn't get enough blood. And usually that starts to compress on the nerves in that case. If that's a sharp, sharp pain and so sharp that you can't walk anymore,
No.
that's a problem. Then you got to immediately do something about it, because they're going to cut that really nicely open, after which you don't have that problem anymore. But if it's just the swelling itself, then
I think it's
compression.
just the swelling, because like, you know, I noticed it, I'm noticing it right now.
Yeah.
And I'm looking here, and this leg is pretty swollen.
Do you walk with compression stockings?
I walk with compression socks, but
Smart.
I should have this morning, I should put I didn't notice swelling this morning because I woke up and my legs were great. So usually after I walked yesterday. I put, you know, just support hose on.
Yep.
And that usually is enough for me. But I didn't do that today, and, you know.
I guess the day after.
So I gotta go
yeah.
home, I gotta go home and put ice, you know.
If you elevate your legs,
Yeah,
that will
elevate
help, but
nice.
elevate them above your heart level. So you have to lay down. When you're sitting up and you elevate your legs, that doesn't help any. You want to make sure that you pretty much lay down to get your leg above heart level, because otherwise the swelling will not go down. But in your case, I would definitely put compression on it. That's also why people run with compression gear in
Yeah,
the
no,
first place.
I have compression from my hips down to my ankles,
Yep.
and then I put extra on my knees because I have Baker's cysts on both knees.
You're ahead of the times, because nowadays everybody uses compression gear, so not a problem whatsoever. It's a smart thing, and you recover afterwards better also, so smart thing. Good question. Go for it.
Does it matter when you stretch, whether you stretch before you run, whether you, I've heard
Yes.
people say, oh, okay.
It makes a huge difference. It used to be that people stretched before running all the time, and then they ran, and then they were good. People have gone back and forth with that anyways. If you look at what's happening with stretching you're just lengthening the muscle relaxes and gets a little bit increased circulation. It warms up a little bit also. If you do that before you do a 5K or something like that, your first mile or first kilometer is going to be slower than it would normally be, because your muscles are still relaxed. Also, if you do a sprint, if you want to train sprinting or something, don't stretch before, because you're setting yourself up for failure, for injury even. That's the reason why when you see the Olympics, when you see a 200-yard dash, they're always jumping up and down before they take off, because they want to get their muscles as tight as possible before they do something. So they prepare themselves for the work that they have to do. So if you're running a marathon, you can stretch before, that's no problem. And dynamic stretching nowadays is a great thing, where people stretch their hamstrings by doing these things 20 times. That works, that's not a problem whatsoever. The real stretching you should do afterwards though, because that's after you've given the muscles the challenge. That's when the muscles are at its tightest. That's when you would want to stretch, and that relieves some delayed onset muscle soreness also, somewhat. So.
But on the after, when you're all fatigued, say you did a half marathon, you don't want to overstretch, which I know you
No,
right?
no, don't do that either, because you already damaged the muscles
Right.
somewhat. If you're heavily stretching after a half marathon or something like that, you will tear the muscles even more.
And that's what
Don't
I
do
used
that.
to always
No,
do.
you want to make it a very light,
Gentle.
gentle stretch. Hold it for 30 seconds. Do it 3 to 5 times. Be done with it. Really. So, anyway, yeah, things have changed over the years now, considerably, because ice baths used to be all the rage. Everybody diving into a big bath with ice, and nowadays they don't do that anymore either. So, I mean, it
So
goes
what
up.
are the rules for cold and hot as far as muscles go? You know,
Good question. All right, cold. You pretty much use most of the time when you either have a really fresh injury where there's still bleeding in there and you want to get rid of the bleeding. By putting cold on there, you contract the torn artery. So if I sprain my ankle right here, put ice on it, you get less bleeding for about 48 hours. You want to just ice it, decrease the extreme reaction of swelling you could get, because otherwise my ankle could be this big. After that, when the swelling is gone, then you can put heat on it, because heat will decrease muscle tension, it will increase circulation, so it speeds up the healing. Now, if I have a lot of inflammatory reaction, if things turn, I mean, if I fall on my knee and my knee is hot and I can fry an egg on it, I'm not going to put any extra heat on it either, because there is so much circulation already in there. That's when you want to ice that stuff. But if your muscles are really tight and you don't have an injury, but you just have muscle tightness, you can put all the heat on that you want and feel good about it. That's where jacuzzi feels really great, especially before you go to bed, because then you fall asleep anyway. So that's no problem whatsoever. Sometimes we do put ice on back injuries just to make sure that the muscles can guard enough. If you take away the guarding of the muscles sometimes, you're actually counterproductive, because you give the body more chance to hurt itself by increasing instability, and you don't want to do that either. So that's where usually heat and ice are. But the rule of thumb is, if it's a fresh injury, if you just sprained your ankle, put ice on it for 48, 72 hours. After that, you can put warmth on it.